system, but we deal with the long-term acute and subacute care facilities all the time. I believe the order in place, or it's not an order, but the guidance is that no visitors. The folks who are in, because of both, typically it correlates with age, and with age you get, multiple medical conditions and comorbidities, that it's better until we have a better handle on this pandemic, that those folks, we limit the ability for outsiders to come in and potentially bring the virus into their facility. So from an acute care standpoint, we stabilize, and then we will send folks back. What we try to do is segment the population if there's some acute condition that needs to be stabilized, and then make sure that the patient hasn't contracted the virus, and then send them back. But I understand the concern, and I think it's stressful not to be able to visit your loved one, but I believe that is the guidance for subacute and long-term acute facilities.
Thank you for that, Alan. If you'd like to ask Congresswoman Kelly and our experts a question, please press *3. And Congressman, right now we've got Kevin in Park Forest on the line with a question for you. Good evening, Kevin.
Hi, Congressman Kelly. Kevin from Park Forest. I was just wondering, with the stimulus package that the Senate and Congress are working on, will you and the Democrats put stipulations to keep big companies like the airlines from using money from stock buybacks to where the people really need money won't end up getting the money they need?
Thank you for the question, Kevin. That was one of the first things we talked about in Dem Caucus, that this was not just to, help big corporations. That we talked about airlines, that we had to make sure that we help the everyday person, the small businesses, which are 50% of our economy. So the third bill we're working on, is definitely about families, hospitals, small business, students, and helping with unemployment insurance, and helping the states with what they need to do. Now, we will do some for big business. We have to have a balance because they employ people too, but we want to make sure they're using the money properly. They're not going to, fire workers. We're going to make sure there's protections for workers when we do give them whatever we wind up giving them. So I think we've learned lessons from before, from 2008, and that's certainly on the minds of at least my Democratic colleagues.
Thank you, Congresswoman. And right now, actually, we're seeing a lot of questions that are very similar. And Dr. Puckett, we kind of like to get your take on this. As a historian, have you ever seen a healthcare crisis like this? And if so, what was done, and how did they manage it, and what can we be doing?
So we certainly have had pandemics before. The Black Plague in the Middle Ages, the Spanish flu in 1918. What was different then is that society could not anticipate, even understood why those diseases had appeared. And in the case of the Black Plague, it killed off half of the European population. What's different today is that we've developed all kinds of analytical capabilities. So we saw this pandemic coming back in January, in early year when it started first surfacing in China. So we knew that something was on the way. What's different for us, and what we haven't learned quite yet, is how to deal with this. And the challenge for us is that it is not just a medical event; it's also impacting our economies. So we have to both balance handling the health challenges that it presents, and also try to figure out how to keep it from disrupting our economic order. And those are two very, very big challenges that we'll learn from. This will be really quite a learning experience, a difficult learning experience, because when we look at the numbers in terms of hospitalizations and mortality from this pandemic, the numbers are really quite startling, and our inability, if we don't manage it correctly, we'll end up making some very, very tough choices that we want to try to avoid. So we have to do what we can right now, and I think the recommendations are, to wash your hands, social distancing, all of those kinds of things that will help slow down the spread of the virus, giving ourselves a chance to learn. Learning meaning we will develop vaccines and we'll develop medications to treat the disease, and also we'll learn how to manage a pandemic while not disrupting everyday life.
Thank you for your perspective on that, Dr. Puckrin. And right now we've got Elaine on the line with a question we'd like to direct to you, Alan Spooner. Good evening, Elaine.
Hi, how you guys doing? I thank you guys for holding this town hall meeting as well. This is it's really not a question. It's I would like to get some type of vision on what is it like if you be diagnosed with if you have symptoms. Because I'm hearing everything right now. It's like, okay, we got all the best practices, everybody doing what we need to do on this side. But what happens when you have all the symptoms and you need to go to the hospital? Because it seems like there's no, I haven't heard a secure plan like, okay, say I get all the symptoms and I call my doctor and say go to the hospital. Is something there to immediately save me? You know what I'm saying? In place?
Hi, Elaine.
You understand what I'm saying? Because it don't seem like nothing is really in place.
I understand what you're saying. Let me try, and then I'm sure the physicians on the line will be able to give even more clinical detailed answer. At the hospital, when you arrive at the hospital, say you arrive via the ED or your physician calls it in and you get directly admitted, if you are exhibiting symptoms, and there's a formula for that. So when you're exhibiting symptoms, if you visited a place with high incidence of the disease, you will ultimately get a test, and you'll be classified as a person under investigation. Now, depending on your symptomatology, like how well you're doing, you will be either admitted to the hospital, awaiting results of your test and being observed by nurses and doctors, or if you are more stable, say you're younger or even older but not exhibiting significant symptoms, you'll be asked to wait for your test results at home. But yet, if you feel like you're running into trouble, to call the hospital immediately or even call 911. If you're exhibiting significant symptoms and having respiratory distress, and there are things that can save you. There's, from my understanding, there's no medication that really attacks the virus, but there are ventilators and management to help patients with their breathing until the virus can run its course. And with that, I'll hand it over to the clinicians because they can give you a more detailed clinical answer.
So this is Dr. Hilton. So that was a great question, Ms. Elaine, as far as what can be done. So for one, yes, there are things that we can do to help you. So whenever you have symptoms, for one, I want to make this clear. If you are concerned, then your doctor should be concerned, meaning that I would never tell someone to not call into their doctor to explain what they're feeling, to if their doctor have capabilities of doing even FaceTime or telemedicine, to call on a video conference so they can actually see you. If you have any kind of doubts, then we need to weigh in and make sure or reassure you, or to say, hey, I think you need to come into the hospital to be seen. Now, let's say you do have symptoms. Let's say you have a fever and you're feeling more winded, like if you're walking up some stairs, whereas you could get up a flight of stairs on Monday, on Wednesday it feels like you're starting to breathe a little heavy. Then if you call your doctor and they say, yes, go into the hospital, the first thing that you'll notice when you go into to the emergency room is if you have a fever, we're gonna do a test where we try to test to see what is the cause of your fever if you're having a virus. the test for to test for these viruses, we'll place a Q-tip. It goes right inside of your nose, and we call it a nasal swab. And this nasal swab, we can send that sample off and test you for one. We're going to test you for the flu because we know that we're still in flu season and that this could potentially be one of the strains of the flu, and that's what we need to kind of treat for you. And we have Tamiflu that we can send you home with. If that flu comes back negative, we know that we're also now starting to test people for coronavirus or this COVID-19. Depending on where you are, the length of time that you may have to get the results back for that test can range from hours to a couple days. Now, that being that wide stretch of when you get the results, it all is based on what your symptoms are of whether or not I say you need to stay here in this hospital or I'm going to send you back home. And what that'll be based on is what are your vital signs showing. If your oxygen saturation, you'll see we'll place a little device on your finger that tells us how much oxygen roughly is in your blood. If your oxygen saturations are above 94%, 95%, and doesn't look like you're having too much difficulty breathing, then great. If at that point, what we may say is it's better to send you back home of where there's no infection. We know that people say they go to the hospital to get healthy, but people go to the hospital when they're sick. And we know there's a lot of diseases that roam around the hospital walls that we don't want you to get, right? If you already have one infection, if you have a virus, we don't want you to pick up a bacteria that happens to live within our hospital from some other patient that we're trying to treat. And so if your symptoms are that you have the fever, but your oxygen level is high to not cause you any problems, and that your breathing doesn't look to be too labored, then we may say go home. And if your symptoms get worse, for sure, come back to the hospital. But for now, we need you to go home and rest and hydrate. Drink plenty of water. Keep yourself isolated from anyone else as much as possible. Wash your hands as much as possible. Now, let's say that your oxygen level, when we check it, is actually low, and that your breathing pattern is showing that you're really working to breathe, that your chest X-ray says, hey, my lungs are not feeling the best. And at that point, we'll admit you to the hospital. And there's a number of different things that we'll take blood work from you to see if we talk about each organ as if they're separate, like your heart, your lungs, your kidneys. But really, if one organ is saying, hey, I'm feeling a little sick, then all the other organs can also say, I'm feeling a little sick. And so we get your blood samples to say, are the kidneys happy? Is the liver happy? Is the heart happy? And we immediately start to give you medicines to support each organ as need be, right? And so it's all really just based on what your body, each individual person is going to respond differently to this virus if they get it. And so we look at your blood work to say, on the outside, you may look the same as you looked last Tuesday, but on the inside, what is telling us that now I need a little help? Now, do we have an exact medicine to fight off this virus? The answer is no. Again, this is a novel virus, meaning that this strain of coronavirus, your body, my body, we've never seen it before. So, but we do have certain antiviral medicines that have been used on other viruses that are now in clinical trials to see can these potentially help. So I hope that helps to answer your question.
Thank you, Dr. Hilton. And actually, we've got Minya on the line right now with a question we'd also like to direct your way. Good evening, Minya. Minya, are you
Hello?
there?
Yes, I'm here.
Hi. What's your
Hi.
question?
So my question is that I was tested for the COVID-19. My results came back that I didn't have COVID-19, but it did detect that I had coronavirus strain. And I'm trying to get an understanding of what that really means.
Right. That's a fantastic question. For one, so the way I explain, and I hate, I just want to say this for a record. I don't come from a medical family, so when I'm explaining things to people, I explain them the way that I wish the doctors would explain it to my family, and not to speak over their heads. So in very simple terms, the coronavirus, you can think of that as almost being a last name. So the Johnsons, right? If your last name is Johnson, you have many cousins in different families, right? The coronavirus is the big umbrella name of a number of different viruses in that same family set, and they're called coronavirus based on their shape. If you Google coronavirus, you'll see a circle with a lot of different spikes coming out of it, and it looks like a crown. So that's where coronavirus comes from, for crown. So there's many different types of viruses that fall under the umbrella of coronavirus, different strains of viruses, meaning that each virus, the coronavirus itself is an RNA virus, and to not get too technical, you have DNA viruses that have two strains, and then you have RNA viruses that have only one strand of genetic material. So the way that the coronavirus replicates itself is it literally inserts its RNA, its one strand of DNA, into your DNA, and it uses your enzymes within your cells to replicate itself. And with that replication, because it's happening so quickly, there's different types of mutation that happens along the way, and each strain of this virus is slightly different. So with the coronavirus, there's many different strains of this type of virus, and it goes, and the severity of illnesses range from the common cold when you're just feeling kind of crappy. The coronavirus, that's the most common virus that causes that kind of cold, all the way to, I don't know if you remember, the SARS epidemic. This was in 2009. It was a really big disease that we saw in China, where a lot of the people from China would start to wear the mask on airplanes. So that is also a coronavirus, right? It's under the umbrella of corona. So when you go into the hospital, like I told a caller earlier, if you have the fever, if you have the symptoms of coughing and shortness of breath, the first thing we'll do is swab your nose. We'll check you for the flu, but we'll check you for a strain of other different viruses. And one of those strains is just a generic branch of coronavirus for all the coronaviruses that we knew beforehand. The difference is that this strain of coronavirus is completely new. We've never seen it before. And so that's why it didn't fall under the viral panels that we typically were sending prior to March of this year in the United States. I hope that.
Thank you, Dr.
Mm-hmm.
Thank you, Dr. Hilton. Congresswoman Kelly, right now we've got Patricia on the line with a question for you. Good evening, Patricia. You're live with Congresswoman Robin Kelly.
Okay, I have two questions. I'd like to know, what are they going to do about the homeless people in the south suburbs?
Well, we wrote a letter to Speaker Pelosi to provide resources to our most vulnerable populations, and the homeless are included. Now, there are various entities that have stepped up a lot in Chicago, and I don't know how, I'm not sure yet because it's new, where they will take people from, but like the YMCA has stepped up since they have to close, and they're going to take people. And then the mayor had a press conference today where 5 hotels are giving their space so that homeless or people that don't have the disease but can't go home, maybe somebody home has the virus and they can't go home, it's different situations, that they're going to take in those people. Maybe they're homeless, maybe they just can't come home, depending on what the situation is. And we're still working on it on a federal level, but also there is a large amount of money that was given to Health and Human Services to oversee some of that also.
Thank you, Congresswoman. Pat, do you want to hop in on that as well?
Sure. I think the Congresswoman hit it now right on the head. The Health and Human Services, they are working really closely and partnering with community organizations to provide funding to these organizations and resources to ensure our homeless population has safe shelter. We're identifying different potential hotels and different areas where we can potentially house individuals where needed. But HHS is working and has a dedicated staff working hand in hand with our community partners and with our community organizations to identify those populations that are at risk and identify properties and locations where we can potentially house them.
Thank you. Before I turn it over to